Greetings. My name is Dr. Rosemari Mealy. I'm an assistant adjunct professor at the City University of New York. I am honored to be participating in this third study seminar on Native American, afrodescendientes, and Latino communities in the United States, sponsored by Casa de las Americas. I would like to thank my friend Zuleika Romay for the invitation, and along with all of those at Casa de las Americas, I applaud you in convening this virtual seminar during a very challenging time for Cuba and its peoples. The United States, which leads the global capitalist system during the era of COVID-19, exposed in greater detail how the economic and social inequalities for generations have been endured by the African diasporic communities. Political factors such as inadequate access to health care always place Black people at higher risk of chronic conditions. During COVID-19, Black people have died at 1/4 times the rates of white people. Systemic racial inequalities in the United States pose the risk of disparities in both testing and in vaccination rates amongst vulnerable populations. This is especially important as COVID-19 has disproportionately impacted racial minorities, and the racial disparities in COVID-19's vaccination rates represent a salient example of racism's serious threats to public health. The systemic denial of adequate services, including access to decent housing, often forces and consigns African diasporic communities to neighborhoods where they have to breathe the dirtiest air, pay the highest rents, drink contaminated water, and their children are relegated to attending some of the poorest and financially neglected public schools. Many of these residents live in what's known as food deserts, where access to shopping for wholesome and healthy food is limited. Perhaps one of the most visible realities for the African diasporic communities have been the decades of being the recipients of massive human rights violations, where police terror and killings are the norm, perpetuated by police and security forces in the false claim of upholding, quote, law and order. The United States health system is an unregulated model that puts profits over the needs of its people. So the coronavirus pandemic overwhelmed the disorganized, unequal, and racist system, exposing all the deep structural problems inherent in the system. Within the African American diasporic communities, the death rate rose exponentially. African people make up 23% of the COVID deaths, despite being only 13% of the total U.S. population. So there was an immediate realization that the state was incapable of responding or providing services to these communities, and shamefully, at many hospitals, trailer morgues were set up on sidewalks where bodies were unable to be released for proper burying to relatives and loved ones. The people then became the experts of their own health experiences by voicing and acting creatively with different types of health initiatives. Here I would like to provide examples of 3 notable grassroots models that served and saved the lives of thousands and have the potential to sustain emergent healthcare crises. One was in the South Bronx section of New York City. Dr. Melissa Barber is one of the 200 U.S. doctors who have graduated from Cuba's world-renowned Latin American School of Medicine, ELAM, in a scholarship program coordinated by the Interreligious Foundation for Community Organizations, IFCO. And during COVID, Dr. Barber put into practice lessons that she learned more than a decade ago as a result of her training at ELAM. Finding her community engulfed in rising COVID cases, super-packed hospitals that were unable to accommodate the quality and the quantity of people that were coming in to be treated or assessed with fever, pneumonia, and flu-like symptoms, Dr. Barber leaped into action, incorporating the skills trained in the Cuban health system, such as surveying and assessing the community's health in an emergency situation. She organized a coalition of South Bronx groups and local tenant associations. They galvanized supplies and resources and became a source of support for the community. Going door to door, the group with volunteers from the community focused on the elderly, young mothers who had infants and small children, and people who were homebound and those who had multiple morbidities and were susceptible to a virus like COVID. They mapped the community access to see where the most vulnerable points were, and from this approach, they were able to provide medical resources and supplies, including gloves, masks, and for those families that had lost their jobs and had children and needed food, the group directed those people to resources in the community that could help them. They raised money for food pantries, delivering them to the most vulnerable identified. And this approach to resolve medical problems during a pandemic was as much about community organizing as it was about repairing bodily ailments. In Philadelphia, Pennsylvania, in April of 2020, African diasporic medical doctor Alice Stanford saw that there was a lack of affordable barrier-free testing for African Americans in and around Philadelphia, and that the majority of the Black counties were infected at 3 times the rate and dying at almost 6 times the rate of people living in majority white counties. So in mid-April of the same year, she began organizing a handful of doctors, launching an independent testing effort, calling the group the Black Doctors COVID-19 Consortium. The group rented a van and started appearing on street corners and in church parking lots, where they started performing thousands of tests daily. And many of the people they tested did not have health insurance, an automobile, a doctor's note, or even symptoms. According to Dr. Sanford, their approach to providing testing became a source of trusted medical care for many Black people who were wary of going to government-run health sites where historically this community has experienced racism and been treated unfairly in the midst and by a medical establishment. Her efforts were groundbreaking because it was the first mobile testing program in the city, and the volunteer African descendant medical team was able to reach communities that were being disproportionately affected by COVID-19, yet underserved. Huntsville, Alabama, southern part of the United States. Aisha Fields is a young African American physicist and community organizer from Huntsville, Alabama. She is a leader of the All African Peoples Development Project. In March of 2020, in the midst of the COVID pandemic, AAPDEP called on the project's Black Ankh Medical Advisory Team to begin writing a variety of COVID protocols covering everything from how to boost individual immune systems to ways that mitigate the risk of catching COVID-19. In July 2020, the organization launched the International COVID-19 Telehealth Program with the goal of making a positive impact on the lives and health of African peoples around the world. The organization provided access to COVID-19 related information and education. Delivering the telehealth program required using sophisticated digital technology, which is staffed by a team of volunteer, licensed medical professionals employing educational guidelines from the Center for Disease Control and the World Health Organization. To date, the group has taken appointments from several U.S. states, Sierra Leone in Africa, South Africa, the UK, and France. The goal of the project for 2022 is to expand the program to provide health information on diseases that are prevalent in the African communities, such as diabetes, hypertension, hyperlipidemia, strokes, and heart disease. The AAPDEP has determined to build Project Black Ink as a permanent program as the African nation's response to the Red Cross. A decolonized approach to delivery of healthcare recognizes that public health and medicine are intertwined, and that community organizations and community organizing allows you to be vigilant to what's going on and to have a pulse of the community. COVID-19 showed us that, quote, you have to have the healthcare infrastructure that's necessary to actually diagnose and treat people to make sure they don't fall into critical areas because they're not screened or caught in time or have access to health care. Now, there are challenges for the U.S. African diaspora community for the next century, and we see those challenges as being a part of a united front. In May of 2020, right on the cusp of the pandemic, millions of people witnessed in real time the Minneapolis-Minnesota murder of George Floyd, who was tortured and choked to death by police officer Derek Chauvin, while other policemen casually looked on without intervening. Massive protests against police violence towards people of African descent erupted throughout the United States and around the world. This elicited outrage, while it had an extraordinary transformation on how the entire world looked at policing in the United States, meant that young African descendants, along with a multiracial, multi-generational movement, kept up the momentum, creating massive demonstrations, boycotts, social media campaigns under the slogan, Black Lives Matter, Justice for George Floyd, and Defund the Police. In June of 2020, 1 month after George Floyd's murder, the United Nations Human Rights Council held what was announced as an urgent debate on current racially inspired human rights violations, systemic racism, police brutality, and violence against peaceful protests in the United States. At that gathering, speakers urged the Council to establish an international commission of inquiry to investigate systemic racial inequality in law enforcement in the United States. The Africa Group placed this important topic on the agenda. On April 27th of this year, the National Conference of Black Lawyers, along with other domestic and international legal entities who were a part of the International Commission of Inquiry on Systemic Police Violence Against People of African Descent in the United States, officially released its report. The commission was established in the wake of the public execution of George Floyd. The families of Mr. Floyd, Breonna Taylor, Michael Brown, and Philando Castile, who were also murdered by the police, joined 600 rights groups and petitioned the United Nations Human Rights Council to appoint a UN Commission of Inquiry to investigate systemic racist police violence and attendant human rights violations against people of African descent in the United States. After succumbing to enormous pressures by the United States and its allies, the Human Rights Commission instead directed the Office of the High Commission of Human Rights to prepare a report on systemic racism and violations of international human rights by police against Africans and people of African descent throughout the world. Including in its findings, recommendations, and analysis were based on live hearings and information on over 44 cases of police maiming and killing directed at Black people in the United States. The Commission found that neither domestic law nor police practices comply with the obligations of the U.S. under international human rights law and standards governing the use of force. United States law is woefully inadequate in protecting people of African descent from police violence. The United States does not have a national legal framework governing the use of force. Moreover, the U.S. Supreme Court has set few limits on the use of force by law enforcement officials, and the limits that have been set do not meet international standards. The United States Congress has not filled the gap. This information was included in the findings plus more. Finally, as human rights abuses continue to escalate, the Spirit of Mandela movement recognized the urgency of taking the case of we the people to an international level. On October the 22nd and 24th of this year, a virtual tribunal was held in another call to action called We Still Charge Genocide, using documents such as those from the International Commission of Inquiry on Systemic Racist Police Violence against people of African descent in the United States and the instruments of international law. The tribunal found the United States guilty of crimes against humanity. The panel of justice came together as an independent body made up of legal scholars, human rights advocates, activists, and community leaders. They heard testimony emphasizing the millions upon millions of indigenous and African people murdered, disappeared, and nearly exterminated over a period from 1492 through the present. Further, the witnesses and prosecutions argued that the wrongs have been historic and deliberate, with colonization, racism, militarism, imperialism, materialism, criminalization, patriarchy, neocolonialism, and internal colonialism as part of the larger process that now manifests itself in medical and digital apartheid, chemical warfare, environmental violence, and racism, disinvestment, and a pandemic of accessible guns and drugs, with the majority of gun violence perpetuated by police and security forces in the false claim of upholding law and order. Statements were made testifying to new forms of colonialism, which includes the prison industrial complex, the military industrial complex, and the commercialization of our health and privatization, commodification of all social services. The testimonies also included substantial evidence of the erasure of histories, distortions, and cultural misappropriations contribute to and exacerbated the attempted invisibility and denial of people's basic humanity. The profound impact of all of these realities extend beyond the erasure and attempts to exterminate Black, brown, and indigenous lives. Hence, as one witness stated, quote, "The colonization of the spirit and mind continue to this day." The testimonies of the tribunal reaffirm the traditional wisdom and knowledge of Black, brown, and indigenous people. The few examples that I cited here are just a minuscule of the momentous issues faced in the African diasporic communities. Furthermore, it is important to highlight that the intellectual anatomy of the systemic and root causes of the problems have sparked resistance. Resistance and resilience have proven from time and time again, even prior to the pandemic, that there is a refusal to accept being dehumanized based on being Black in the United States. And this resistance will continue to be engaged in the social justice arena and the fight back to organize, advocate, and strategize with others in united front and global efforts preparing for the next century of struggle and revolutionary change. In closing, the spirit and memory of Malcolm X and President Fidel Castro, I raise up their names in commemoration of the 1960 Harlem, New York meeting when bonds of solidarity between our two peoples were forged, and in their memory, we continue to carry forth and affirm that solidarity with the peoples of Cuba is entwined. Thank you for listening and watching.